The Valerie Fund was started by Sue and Ed Goldstein in 1976 after their 9-year-old daughter Valerie lost her battle with cancer. Countless trips to New York for Valerie's treatments inspired them to ensure that other families would have oncology and hematology care close to home.
When Valerie was sick, we left Stacy, who was 2 years older than Val, at home with babysitters. And she didn't like it, and we didn't like it. When she stayed over in the hospital, when she had surgery, we had to leave at 8 o'clock. And here's a little 3-year-old who was by herself. It was not a good system. We decided to call some friends of ours.
And told them a little bit about our experience of fighting the traffic with a sick child going into New York. And we thought that the doctors in New Jersey are just as good as New York. We first went to Overlook Hospital, and they were looking to start a cancer center there. So we kind of merged with them.
The first core services we offered to families were social workers and child life specialists, starting at Overlook Medical Center, the first of our 7 centers.
Once this experience happens to families, there's so many facets that touch the family in terms of whether it be school, whether it be work, whether it be siblings, whether it be just the garbage goes out on Tuesday and the mortgage gets paid once a month, or the rent. So it was really a concomitant of hats that social workers wear when they work in the Valerie Fund Children's Center.
The first day I walked into the Valerie Center, I knew I had family. I knew I had people that cared about me.
They helped me so much till this day. Even when he just was in the hospital recently again, they helped me.
Because the social workers, because the psychologists we have, they meet with the family right with us from up front, right on day one.
I don't know what I would have done, without him.
I think the most important thing is to help the children understand their diagnosis and the procedures that they're having in kid words. In a younger child, we might use things like a play doctor kit just to help familiarize them with those materials. We'll have them use them on dolls, on stuffed animals, whatever they would like to, so that they're not so fearful when they're seeing them during a medical procedure.
More than 30 years ago, Camp Happy Times started a free week of camp for children who have or have had cancer.
You get to enjoy all the freedoms that camp gives you and still have all the responsibilities of being whatever age you are.
By the end of the week, nobody wants to go home.
Having the ability to come back to being with other people that have been ill, like yourself, and then get to go back to, what I kind of call my real world, My real world is, what a large degree the Valerie Fund has given us, in that it gives you the independence to know that you will not be your disease for forever, and you will remember being sick, but it will just be a period of time.
With your help, we can continue to expand Valerie Fund programs with education liaisons, integrative medicine, palliative care, and long-term follow-up plans.
The education liaison will help to transition kids back to school as they're finishing treatment for oncology, but they're also going to be there to help us maintain quality schoolwork in all of the hematology patients as well.
Our integrative medicine which is one thing that's very close to my heart, because we feel like it's so important, the difference that the families feel of getting acupuncture while they're sitting in clinic while their child's getting chemotherapy, or seeing a 6-year-old with a acupuncture needle in his head to prevent nausea.
I have had massages on the days I'm not feeling great, sometimes energy work, because I don't like being touched very much.
Palliative care is meant to be supportive, additional care aimed at providing an improved quality of life for patients throughout their fight and beyond.
Long-term follow-up program really matters for continuation well into adulthood.
When you treat a child with cancer, there are potential effects that can occur even years after the chemotherapy is completed. And so we have a multidisciplinary team to meet with the families and review how the child and the family is doing.
Once we knew we had a formula and we started working it, and each year it got bigger and better because of all the people that have helped us. And each one allowed us to continue our mission of having centers throughout the state. And as you know, we just opened up St. Joseph's in Patterson, which pulls the whole state together.
I'm just so excited that you guys have decided to take us on, because I think we have an amazing program, and we're going to be even more amazing with the help of the Valerie Fund.
The Valerie Fund coming in has kind of given us the opportunity to really expand some of our psychosocial positions. The whole family is going to be able to work together through the disease process rather than just the child or just the parent.
They got me through this, they got my grandson through it, you know, my family, you know, and I really, really, really appreciate it.
She was the mom I never wanted, but it ended up being amazing.
Even though the medicine has got more sophisticated, that sort of that homey feeling hasn't gone away.
Once they're our patient, they're always our patient.
Most of the children that I've spoken to have looked back upon their experience at the Valerie Fund as being just wonderful.
It's what we did, not what Sue and I have done, because we could not have done it with so many good people throughout the state who have come through the woodwork to help us. And they were from all walks of life. And that's what the Valerie Fund is about. It's a people organization.